And again, I'm going to kind of show you how to think like a test maker because I wrote this question. So this is a very, very plausible situation that you would get as a question that you may see on the boards. And I really want you to pay attention to what I put in here. And I didn't put a lot of, I didn't make this tricky, okay? So those of you that find this tricky, I want you to see that there's a lot of ways that the boards are going to put distractors. So they're not tricky, they're distractors, right? So if you can identify in prioritization what distractors are, then you're going to look at them and be like, oh, I know what that is. And if you are doing your questions, I don't want you to just identify the right answer. I want you to tell me why the other ones are wrong. So we use the method that everyone's been talking about, and you're going to look at which of the following clients should the nurse see first. So what do I say about first, initial, priority, urgent, most concerning, immediate, report to HCP? If a question ends in that, what type of question is it? Yeah, it's one that we're freaking out about, or FOA, or a prioritization question, right? So if we're looking for something that we're freaking out about, what are we looking for? What mnemonic that have I come up with that I want you to utilize during these situations? Ask Graph, right? Ask Graph. Those of you that don't know what Ask Graph is, it's on YouTube, it's on podcasts, it's on Instagram, it's on our story right now. It's everywhere. Like literally, it is my claim to fame. So when I figured out this pattern, I was like, all right, utilize this to its fullest. So now we figure out the situation. The situation is a nurse is seeing 4 patients who were recently admitted to the ER. So now we use the method and we start from number 4. In prioritization questions, we don't make a decision. We don't make a decision. So I want you to look at number 4, and all I want you to do is compare it to number 3. That's it. Don't go on to 2 and 1. Just stick with number 4 and compare it to number 3. So with number 4, we got a client who's in a bar fight, now has multiple superficial lacerations that are bleeding from a knife fight or a knife wound. So when I wrote this, I said, all right, cool. Let me compare it to number 3. And now I've got a client who was playing football a few days after being diagnosed with infectious mononucleosis and now has a blood pressure of 90/45. All right, hold on one second. Let's just see between these two. People were confused. Well, this person's got knife lacerations. They've got knife lacerations and they're bleeding. They're hemorrhaging. No, they're not. They've got a superficial laceration. Look at the words I use, right? I used a knife to throw you off. I used the word bleeding to throw you off. But the thing I showed you was it was a superficial laceration, which means what? We're probably going to irrigate it. We're probably going to clean it out and we're going to stitch it up. And that's about it. Maybe a tetanus shot or whatever we got to do on top of it. But that's it. I don't got to worry about this person. Like, hold up one second. Let's take care of the patient. Of the two, what about infectious mononucleosis scares us? What can they develop? Splenomegaly, right? So what do we tell them when they develop infectious mononucleosis? We say to avoid contact sports. Because if they play a contact sport, I didn't say contact sports because I know everyone knows what a contact sport is. So maybe I throw in football in there. Maybe I throw in rugby in there. I throw in something that is a contact sport because now it's a few days after they were diagnosed with it. So again, if I give you time, age, gender, anatomical location, lab values, I'm giving it to you for a reason, right? As a test maker, I'm giving you a clue here. A few days after, how long are you supposed to wait after infectious mononucleosis in order to continue your contact sports? You're supposed to wait about 2 weeks or until you're cleared by your HCP. But this person is hypotensive. What are the 2 parameters, the lab values that or vital signs we're going to look at that are going to indicate that this person is hemorrhaging? Hypotension and tachycardia, right? Is this hypotension? That diastolic is really low. That diastolic is really low. And I know I don't really talk about it, but if you're to calculate the mean arterial pressure here, what is the mean arterial pressure? I'll actually talk about this because I don't really talk about this much. What is the mean arterial pressure? This is the arterial pressure that is needed to do what? To perfuse our organs. And what is the normal range? 70 to 110. 70 to 110 millimeters of mercury. 70 to 110 millimeters of mercury. So let's do the math here. So how do you figure out your math? So this could be med math as well too. So you've got your systolic blood pressure plus 2 times your diastolic blood pressure divided by 3. So what does the map equal here? So we've got what? We've got 90 plus 90 over 3. So that's what? 180 over 3. So their mean arterial pressure is 60 millimeters per mercury. But our normal level should be what? 70 to 110. So if this person is now hemorrhaging, they're not going to perfuse their organs. They are severely hypotensive, especially when that diastolic drops below 60. So now they're not going to perfuse their organs, brain, kidney, lungs, heart, everywhere, right? So you have to pay attention. On the boards, I'm going to give you easy numbers because I'm not going to have you do some odd math for the most part. So that's why I made it 90 over 90 plus 90 divided by 3. It's an easy 180 divided by 3, which is 60. So now we're at multi-system organ failure. So yeah, I get rid of number 4. I haven't decided with number 3. I'm going to compare it to number 2. A client who has crackles, malaise, and a temperature of 102.4. So wait a minute, crackles, what does that mean? It's probably fluid where? In the lungs. And then the malaise and a temperature of 102.4. What do we think is going on here? Pneumonia. Yeah. See, I'm telling you what it is. And I'm telling you why. Well, there's crackles. Okay, pneumonia is going to have fluid. Oh, there's malaise. Well, yeah, people got those body aches and other signs and symptoms, right? Then you've got loss of appetite, fatigue, all that stuff, that general malaise. And then your temperature is 102.4, which is indicative of a pneumonia, right? It's a little bit higher. So is this airway? What did I say is a distractor? Pneumonia is a distractor. It's not airway. What are you going to do? You're going to do symptomatic care and give them some antibiotics. That's about it. Maybe some oxygen if they need. Sure. But we're not freaking out about it. So this is where a lot of students made mistakes. A lot of students made mistakes between this one and this one. And I put those in there as an example to trick you. Well, not trick you, to show you distractors. And lastly, a client who's playing basketball who is complaining of severe pain around the ankle area. So what do you think they did? They probably rolled their ankle, bone bruise, fracture, swollen ankle, sprain, yeah, whatever it is. Again, I'm using pain because people think about pain and they're like, oh, dang, a knife, that hurts. Oh, dang, broken ankle, whatever, that hurts. But do we have time? Do we have time? Yes, we do. We do. This person is actively hemorrhaging. So we found one of Ask Graph. None of the other ones fall into Ask Graph, and of Ask Graph, it is hemorrhage. Cool. So this is a question of the day today. When I wrote this is what I want you to see. There's a lot of distractors, and the board's going to try and get you. I don't want you to sit there and bang your head against the wall thinking, oh, whoa, I didn't get this. Cool.